Good evening, and it's my pleasure to be visiting tonight with Sidney and Sithole. How do we say your last name, Sidney?
Yes, that's
That,
correct,
that was
Sithole.
close. Okay.
Yeah.
And so, Sidney, on behalf of the BYU Management Society and their Young Professional Career Engagement Program, it's my pleasure to just spend a few minutes with you and to learn from you. But as we begin, we would like if you would take just a few minutes to talk about, a little bit about yourself, if you're married, where you're from, and then if there was anything that kind of led you to your current position, and talk a little bit about what your current position is professionally.
Okay. Thank you very much, Rupa. Um, and indeed, it's Sithole. My full name is Sidney Sithole. I'm 34 years old. I'm married. I got married in 2017. Um, that's a few years after I had completed a degree in an honors degree in Bachelor of Medical Laboratory Sciences with the University of Zimbabwe. So I am from Zimbabwe, and I am a member of the Church of Jesus Christ of Latter-day Saints. I was baptized when I was about 9 years old in 1997. My hometown is Mutare, but I relocated to Harare, where I did my tertiary education, and this is also where I'm currently working. I'm working for an organization called University of Zimbabwe Clinical Trials Research Center.
Mm. Excellent.
Yes.
Well, thank you, and that's a beautiful background. Now, talk about before, what did you do to get to your current job? Talk about, how you approached your studies. In the US, we say high school, how you approached your studies in high school, and
Yeah.
then, how you decided to pursue your college studies, university studies, and, what did you do there that kind of helped qualify you for what you're doing now?
Okay. Thank you very much. So in our setting here, I'm from Zimbabwe. To qualify to do a degree in Bachelor of Medical Laboratory Sciences, you have to have done sciences in high school. And I'm sure in Southern Africa as well, the concept is the same. You must have done science subjects, and by science subjects, the critical subject is chemistry.
Mhm.
And they also require two other subjects. I did mathematics and I also did biology. So that's what they require at advanced level studies. But for ordinary level studies, they also require you to have at least 5 ordinary level passes, including English and maths, and also science subjects as well are required. It could be pure physics, pure biology, chemistry, and other subjects that you might have, like English as well. It's important. So those are the prerequisite for you to enroll in an undergraduate degree for medical laboratory sciences. And you have to, so we use more like the Cambridge system in our country. The enrollment centers, we sort of have a bottleneck system in our country, because there are only about 2 universities that take people who want to do medical laboratory sciences. And so there's sort of a bottleneck system. And so you have to aim really high for you to qualify. From those 3 subjects, they say you need to have about 12 points, 12 out of 15 points. That's the minimum cutoff that they need. So at an early age, even in high school, you need to have that in mind, that if you want to progress and do this program, you have to work really hard. I think the target should be to get all 15 points. But if you get 12 as the minimum, you still stand a chance to be enrolled to doing this program. It's a 4-year degree program, which starts off with basic sciences, laboratory techniques. So you learn the normal things about health. What's normal in your body in terms of the biology? What's normal in your body in terms of the chemistry? what's normal in your body in terms of the microbiology. And then you move on to the second year where you learn about techniques. What techniques can you use in chemistry? What techniques can you use in biology? What techniques can you use in hematology or in blood? And then your third year, you are on attachment. And on attachment, you work under supervision. You actually go into actual laboratories, clinical laboratories, and you work under supervision as you get training, practical training. After the end of that practical training, you have an exam, which is a practical exam, to where you can actually now perform all these tests practically in the laboratory. And then your final year, you then learn about the abnormal things or the pathology. What's abnormal in terms of the chemistry of the body, and then you apply the techniques. How do you detect that this is wrong in the laboratory? How can you diagnose someone of a certain disease? So you then learn about all these diseases, and towards the end, you also do a dissertation where you come up with a concept of how you can apply the techniques you've learned throughout the years to solve a particular health problem that you might have observed. And after you complete those 4 years and you've graduated, for you to practice, you need to go through another year of internship. So you attach yourself to a laboratory where you now are able to then touch the samples and process the samples, but you are doing this under supervision, and you rotate over all these departments that are present in the laboratory. And after you have completed successfully for a year, you are then registered by a professional body. In our case, we've got what is called the Medical Laboratory and Clinical Council of Zimbabwe. So you are registered there, and they also require you to have continual learning for you to renew your registration or your subscription, which is done annually. So I followed all these processes. I was fortunate that during my attachment, I was attached at the busiest hospital in the country. And for my internship, I was attached at the biggest hospital in the country. So that gave me a lot of opportunities to learn diagnostic skills. But however, after my internship, I decided to diversify a little bit because I really wanted to have an impact in people's health. And I then went into research settings. And so I took a job opening, which was a shorter contract and less remuneration, but I still jumped into that opportunity because I wanted to be involved in clinical research, because I believed that with clinical research, the impact that you can have in terms of transforming people's health can be vast, because you can reach out even to policy making and so forth. And so after you graduate, there are many other avenues that you can take. I chose the clinical research aspect, but one can choose to work in sales. You can sell laboratory equipment. One can choose to go into diagnostic laboratory, where you can work in a hospital setting, diagnosing patients. One can also choose to go in the business route. You can open a medical laboratory practice in the country, and you can you can offer services to clinicians, because you work closely with clinicians. They can refer patients to you. You test those samples for a fee, and you can be very profitable as well. So there are several other avenues that are there. One important thing I should mention is that in our country, and this is also very true in many different countries, there is 100% employment rate for this program. There's no one that has gone through this program that is not employed. Of course, there are jobs that are better than others, but at the very least, you will get something in terms of employment. And I always believe that, besides remuneration, there are other things to consider, such as experience and mentorship. For me, for example, in my second job, after my internship, I took that job I mentioned earlier at a research lab, which offered me less remuneration, but the experience that I gained in that laboratory helped me to progress even further than what I would have if I had taken a more paying job without any research experience. I then also took up a postgraduate. I studied a master's of public health. Because I had chosen the route of research, I wanted to gain a better understanding of a holistic approach to health. And so I did a master's of public health, which then helped me to better apply the research skills that I have currently. Yeah, I don't know if I should go on.
Yeah, no, let's pause there for a second. That's I was trying to take copious notes as you're going through that, because that's amazing. And I guess, one of the things I thought is it sounds like, sometimes it's human nature that people want to take the easiest course, right? What's the fastest way to do something? Or what seems to maybe offer the best return? But it sounds like somewhere you've kind of taught yourself, well, don't take the easiest way. Um, do what's hard, and do what's going to expand your learning, and be more holistic. How did you develop that mindset? How did you develop, and what did you do when other people were out playing as students and things, and relaxing? What did you do to have that self-discipline to force yourself to focus and to put forth the effort that you did?
Thank you for that question. I'll probably, I think I can mention maybe two things that I think are key in helping me have a bit of focus in terms of my career development. The first thing I would mention is that I think a lot of my life has been hinged on the missionary experience that I had as a young man. When I served 2 years, I served in the South Africa Johannesburg mission. And during that time, hard work and diligence almost became my middle name, because you are taught to do that. And so I learned that from companions that I served with. I learned that from my mission president. And as soon as I came back from my mission, I was determined to apply the principles I had learned on mission in my own personal life and career even. And so that gave me that foundation, that grooming that I got from mission. And the second aspect I wanted to mention is the issue of mentorship. I think it's a bit easier if you have someone who has walked the path that you intend to walk, to guide you and help you. And so I was fortunate enough to get mentors that helped to direct my course. Most of them were members of the church. And although some of them were not particularly in the discipline that I had chosen, but they were able to guide me in terms of the right things, the right decisions to make in terms of career growth and so forth. And so I think those are key things that can help. So I would suggest to someone who is in the beginning of their career to identify someone who can help them as they make some of these decisions. They won't tell you everything what to do, but they'll guide you, and this will make your decisions a bit clearer as you go.
Thank you. That's excellent advice, and I love that focus and that importance of mentorship. And that's really what this program is designed to do, is to help people realize there are ways to learn. In the background, the explanation you provided. So let's step back for just a second. Let's say somebody doesn't go exactly the way that you did, but they still want to do something in like applied health. And BYU Pathway offers a degree, an associate degree and a bachelor's degree in applied health. does that help create opportunities for people if they go through that program in Zimbabwe? And do you have any thoughts about that?
Yes, definitely. I would say first and foremost, obtaining a degree from a reputable university, particularly international university like BYU, goes a long way in credibility in terms of finding employment in a country like ours.
Mm-hmm.
And so just that alone is a big step forward. And then secondly, there is a huge demand for public health practitioners. And I assume an equivalent of people who have done applied health, people who do what we call here health education and promotion.
Mm-hmm.
So we've got a similar sort of degree in our country called health education and promotion. The opportunities are there. So the majority of these opportunities are then posted in rural settings.
Mm.
So that's a bit of a drawback in terms of the placement of these because you are dealing mainly with public health, and so that's where you are. But the opportunities become even more when you then take up a master's program. So say a master's in public health or a master's in epidemiology. And the target really would be international organizations. We've got CDC, Centers for Disease Control. We've got UN agencies here. We also have other research entities, Melinda and Gates Foundation, and so forth. So these would be quite rewarding organizations to work for. But I guess, like I said, earlier, you have to be also a bit patient. It does not mean, as soon as you finish applied health, you automatically get a job there. It's possible, but I think the competition becomes a bit better when you have a postgraduate qualification.
Mm-hmm.
Yeah.
Thank you. That's very good. So I was just processing some of the information you said, and earlier you talked about, the career path that you went, really almost guarantees 100% employment, right? Which is a wonderful a wonderful situation to be in. And then this conversation, you talked about the idea, just keep getting relevant education, because the more relevant education you get, the more qualified you are, and the more that you have control over your destiny, because you create more value. Which is really clear. And it's great to hear some of the international organizations there that are providing services there and that need talent. And in the world today, we're in this war for global talent, right? And so that's a great opportunity that never existed before with the internet, that global talent, you can live in Zimbabwe and do phenomenal work for excellent institutions, because you have that global standard of excellence. And so to push yourself. Well, Sidney, before we close, do you have any other advice to people that you would be aware of in Zimbabwe or other countries in Africa that have a similar setting, of things that they can do, or things that they should be mindful of, choices they can make to pay the price to push themselves forward? Any final advice or counsel?
I think staying close to the Lord is very important. In our country, we've got unemployment sometimes as high as 90%. And the 10% that are employed sometimes does not necessarily mean that they are the best, but maybe the Lord was merciful to them. And maybe I also fall into that category. And so I think it's important to stay close to the Lord. And when you have obtained that job or that work opportunity, it's also equally important to be diligent in that job. I just, especially in health, it's more than just a profession. To me, I think it's partly a calling. And so for me, as I take it, I want to apply the words of King Benjamin in Mosiah 2:17 to that when you're in the service of fellow beings, you're in the service of God. And again in Colossians 3:23, which talks about how whatever you do in terms of your work as if you are working for the Lord. And so I think when you are in the health profession, it's very important to know that you are doing a great work and you need to give it your very best. Work as if you're working for the Lord because he's the one who employed you in the first place. And you are in the service of your fellow beings in King Benjamin's word. So I know it's not easy. As young adults, there's a lot of uncertainty, but if you work hard, improve yourselves, and be diligent in whatever it is. It could be during school, it could be during work. It's important to be diligent in what you do. Don't let anyone outwork you. Make sure you work very hard. That's my concluding suggestions, Rupa.
Sydney, that is beautiful, and I love that last phrase about "don't let anyone outwork you." Right? That's just that persistence. And there's a great book out there. It's a TED Talk too by Angela Duckworth, and she talks about successful people have passion and they have persistence. Right? And I can certainly feel both of those in you as you've spoken today. So, on behalf of the BYU Management Society, we thank you for taking the time, both you and your wife, to visit with us in these separate interviews and to talk about your path to success, but very importantly, to be so open about what people can do today to have similar success and to do the things that God would have them do. So thank you very much. You're a great blessing to us, and I'm sure you are to your institution that you work at. And we thank you for who you are.
It's my pleasure. Thank you very much, Rupa.